Imagine that you are standing on top of a mysterious ancient observatory high above the clouds. It is midnight. The sky is filled with brilliant stars, planets, constellations, and glowing zodiac signs. At the entrance of this magical observatory, there is a strange sign that reads, An-Astrology. The moment you hear An-Astrology, think of Anastrozole. This is our main phonetic and visual anchor. Anastrozole is an aromatase inhibitor, and this entire astronomical world is designed to help you remember exactly how it works, who receives it, what type of cancer it treats, and its important adverse effects. As you enter the observatory, you meet a mysterious woman called the An-Astrologer. She is an older woman who represents the postmenopausal patient. She is standing beside a huge telescope, carefully observing the stars. This is an important clue because anastrozole is primarily used as endocrine therapy in postmenopausal women with hormone receptor-positive breast cancer. So whenever you see the An-Astrologer standing inside this observatory, remember, Anastrozole postmenopausal woman. Now look toward the sky. Floating above the observatory is a powerful glowing testosterone ox, representing androgens. The ox is carrying androgen molecules through the sky. Nearby, you can see a beautiful glowing estrogen goddess, representing estrogen. Normally, androgens can be converted into estrogens by an enzyme called aromatase. Imagine this conversion as a magical pathway connecting the testosterone ox to the estrogen goddess. The androgen enters the pathway, and aromatase transforms it into estrogen. But suddenly, the An-Astrologer raises her telescope toward the sky. Attached to the telescope is a huge glowing X. This X represents aromatase inhibition. Anastrozole blocks the enzyme aromatase, preventing the conversion of androgens into estrogens. So the testosterone ox can no longer reach the estrogen goddess. The pathway is blocked. Estrogen production falls dramatically. This is the central mechanism of anastrozole, inhibition of aromatase and blockade of peripheral androgen-to-estrogen conversion. Now look closely at the telescope. In front of it is a giant aromatase inhibitor gate, marked with the letter X. Imagine the gate completely shutting down the pathway. The message is simple. Anastrozole puts an X on aromatase. Less aromatase means less conversion of androgen into estrogen, and therefore lower circulating estrogen levels. As you continue walking through the observatory, you suddenly notice a strange constellation in the sky. It looks like a crab, and beside it is a glowing symbol of a breast with a positive sign. This is the Cancer crab and breast-positive star. The crab represents cancer, while the positive breast represents hormone receptor-positive breast cancer, specifically tumors that express estrogen receptors and slash or progesterone receptors. Because these cancers depend on estrogen signaling, reducing estrogen levels can slow their growth. Therefore, when you see the Cancer crab near the positive breast constellation, remember the major clinical indication: ER-positive or PR-positive breast cancer in postmenopausal women. Now the An-Astrologer continues looking through her telescope, but suddenly the observatory becomes extremely hot. Flames begin appearing around her. A giant cosmic hot flash fire erupts across the floor. The An-Astrologer begins feeling intensely warm and uncomfortable. This represents one of the important adverse effects of aromatase inhibitors, hot flashes. Because estrogen levels fall, patients can experience menopausal-type symptoms, particularly vasomotor symptoms such as hot flashes. But the story does not end there. As the cosmic flames continue burning, the An-Astrologer develops painful, stiff joints. Her knees, wrists, and fingers begin to ache. This represents another classic adverse effect of anastrozole, arthralgia or joint pain. So the cosmic hot flash fire should remind you of two major clinical effects: hot flashes and joint pain. Then something even more dramatic happens. The stone railing around the observatory begins to crumble. The railing represents the patient's skeleton, and as estrogen levels fall, the bones gradually become weaker. The An-Astrologer watches as the skeletal railing becomes fragile and begins to break apart. This represents bone loss and osteoporosis, an important long-term adverse effect of aromatase inhibitor therapy. Therefore, when you see the skeletal railing collapsing, remember that anastrozole can increase the risk of osteoporosis and fractures, because estrogen has an important protective effect on bone. Now step back and look at the entire astronomical scene. At the center is the An-Astrology Observatory, giving you the phonetic connection to anastrozole. Inside stands the postmenopausal An-Astrologer, reminding you of the target population. Above her is the testosterone ox, representing androgen. Nearby is the estrogen goddess, representing estrogen. Between them stands the giant X on the telescope, representing aromatase inhibition and blocking androgen-to-estrogen conversion. In the sky, the cancer crab beside the positive breast represents hormone receptor-positive breast cancer, the major clinical setting. Finally, the cosmic hot flash fire, painful joints, and collapsing skeletal railing represent the major adverse effects: hot flashes, arthralgia, and osteoporosis. So whenever you encounter anastrozole in an examination, do not try to memorize isolated facts. Instead, return to the observatory. See the An-Astrologer, remember the postmenopausal woman, look at the testosterone ox and estrogen goddess, and then watch the giant X block aromatase. Remember that this reduces estrogen production and is particularly useful in hormone receptor-positive breast cancer. Finally, feel the cosmic heat, the painful joints, and the weakening skeletal railing, reminding you of hot flashes, arthralgia, and osteoporosis. The entire story can therefore be remembered as one simple scene. An-Astrology leads you to anastrozole. The postmenopausal An-Astrologer receives the drug. The testosterone ox cannot reach the estrogen goddess because the aromatase pathway is blocked by an X. The cancer crab beside the positive breast represents ER/PR-positive breast cancer. And the hot flash fire, aching joints, and collapsing bones remind you of the major adverse effects. Once you can visualize this strange cosmic observatory, the essential pharmacology of anastrozole becomes much easier to recall.